I would say that most dental offices do not have the position of a treatment coordinator in their office. And yet virtually everyone could benefit from that for sure. And the way I'd like you to think about it is this way, Naren. Think about the public. Now, we have to be careful about this because we're so close to dentistry that we know too much. You know, you do, I do, our listeners know too much. Whether you're a dentist or a team member listening to this, we know a lot. We know what dentistry can do for people today. But does the typical, person from the public know all the cool things that dentistry can do for them? Now, there are people that know. There are people that know about cosmetic dentistry and they're deliberately searching for cosmetic dentistry.
Right.
But many times the public doesn't really know. In fact, we know for a fact that a significant portion of the population doesn't go to the dentist at all.
Yes.
More than half don't go to the dentist. And the only time they go to the dentist is when they have a problem, And that certainly, represents, a sizable element in every practice. But the public doesn't really know what dentistry can do for them. And when I think about how the treatment coordinator plays into that, the treatment coordinator helps patients understand all the cool things that dentistry can do for them.
Exactly.
And in particular, the benefits that type of care can provide to the patient. And in essence, they become, that treatment coordinator becomes the guide. Think about the guide. Recently, my wife and I had the opportunity to spend a weekend in Santa Fe, New Mexico. We enjoy Santa Fe an awful lot. We've been there many times. We enjoy visiting Santa Fe. And we decided to do something a little bit different. And we decided to go on a walking tour of Santa Fe. And it was led by a guide. And now we visited many times before. And I thought we knew a lot about Santa Fe. But Naren, there were more things we didn't know about Santa Fe than we did after this 90-minute walking tour. We learned so many new things. And so we can't wait to go back now and experience all the new things that we learned about Santa Fe. Right. And yet, we were kind of veteran Santa Fe travelers. We've been there and we knew about it. But this guide giving the walking tour opened our eyes to things and we're literally making plans quickly to return because we want to experience those things that we learned about, in the tour. So think about your treatment coordinator as being a guide. And another way I'd like you to think about it, think of that individual as being an advocate for the patient.